What is Artemether? Artemether is an antimalarial agent for the treatment of uncomplicated acute malaria. For enhanced efficacy, it is given in combination with Lumefantrine. This combination therapy exerts its effects against Plasmodium spp. Erythrocytic stages. It can be used to treat infections caused by P. falciparum and unidentified species of Plasmodium, including chloroquine-resistant infections. Artemether uses. This medicine is used to treat malaria in adults and children. Contains antimalarial drugs. Malaria is caused by mosquito bites in endemic regions. Parasites enter the body, residing in red blood cells or the liver. Destroys malaria parasites in red blood cells. Liver-targeting drugs like primaquine may be needed for complete treatment. Ensures full recovery and prevents malaria relapse. Not used for malaria prevention. Artemether side effects. Some of the common side effects of Artemether are headache, dizziness, loss of appetite, weakness, fever, chills, abdominal pain, cough, trouble sleeping. Some of the serious side effects of Artemether are rash, itching/swelling, trouble breathing. If you have any of these serious symptoms, immediately contact the doctor for further assistance. In any case, due to Artemether, if you get any kind of reactions in the body, try avoiding it. A doctor advised you to take the medicines by seeing the problems, and the benefits of this medicine are greater than the side effects. Majority of the people who use this medicine don't show any side effects. Get medical help immediately if you get any serious Artemether side effects. Artemether precautions. Before taking Artemether, talk with the doctor if you are allergic to it or any other medications. The product may contain some inactive ingredients which can cause some serious problems. Before using Artemether, talk with the doctor if you are having any medical history such as kidney problems, liver problems, stomach disease, ulcers. Artemether can cause severe conditions which can affect the heart rhythm, QT prolongation. QT prolongation will rarely cause some serious and irregular heartbeat and other symptoms which needs medical attention. How to take Artemether? Take this medicine orally, with food, just as your doctor has prescribed it. Usually, this drug is taken twice a day for 3 days with a meal, 6 doses, or as instructed by your doctor. Take the first Artemether dose of food on the first day of therapy, followed 8 hours later by your second dose. Then you can take 1 dose in the morning and 1 dose in the evening per day for the next 2 days. With food or milk, infant formula, pudding, porridge, or broth, it is necessary to take every dose of this drug. Food helps function well with this drug. If you are not able to eat, tell your doctor. With food or milk, infant formula, pudding, porridge, or broth, it is necessary to take every dose of this drug. Food helps function well with this drug. If you are not able to eat, tell your doctor. Artemether dosage. Overdose. Overdose of a drug can be accidental. If you have taken more than the prescribed Artemether tablets, there is a chance of getting a harmful effect on your body's functions. Overdose of a medicine can lead to some medical emergency. Missed dose. Missing 1 or 2 doses of Artemether won't show any effect on the body. The skip dose causes no problem. But with some medication, it won't work if you don't take the dosage on time. If you miss a dose, some sudden chemical change may affect your body. In some cases, your doctor would advise you to take the prescribed medicine as soon as possible if you have missed the dose. Interactions. Drug interactions can affect the working of the drugs or increase the risk of serious side effects. Not all potential drug interactions are included in this paper. Keep a list and share it with the doctor and pharmacist of all the medications you use, including prescription/non-prescription medicines and herbal products. Do not start, stop, or change the dosage of any drug without being treated by the doctor. Before the treatment with Artemether/Lumefantrine, be sure to tell your doctor about any drugs you take for malaria. Within 1 month of treatment with Artemether/Lumefantrine, certain antimalarial medications, such as halofantrine, should not be used. A severe, possibly fatal, association with drugs can occur in some cases. Artemether storage. Direct contact with heat, air, and light may damage your medicines. The exposure of medicine may cause some harmful effects. The medicine must be kept in a safe place and out of children's reach. Mainly, the drug should be kept at room temperature between 68 degrees Fahrenheit and 77 degrees Fahrenheit, 20 degrees Celsius and 25 degrees Celsius. Before taking Artemether, consult your doctor. In case if you face any problems or get any side effects after taking Artemether, rush immediately to your nearby hospital or consult your doctor for better treatment. Carry your medications always in your bag while traveling to avoid any immediate emergencies. Follow your prescription and follow your doctor advice whenever you take Artemether. Why is this medication prescribed? Artemether is prescribed for the treatment of acute, uncomplicated malaria infections caused by Plasmodium falciparum. It is not used to prevent malaria or treat severe cases. Usually, it is combined with Lumefantrine to improve its effectiveness and to avoid resistance to the medication. What special dietary instructions should I follow? Take with food. It works better when taken with food, especially a meal rich in fat. Stay hydrated, drink plenty of water to avoid dehydration due to fever. Avoid alcohol. Alcohol can increase side effects like nausea and dizziness. Healthy diet. Eat a balanced diet with fruits, vegetables, and proteins to aid recovery. Avoid grapefruit. Grapefruit and its juice can interfere with the medicine, so it's best to avoid them.